Okay, back for another update. This is now 2 weeks and 1 day after surgery. I just went to see my surgeon for a post-op follow-up, and there was lots to discuss. So the good news is that the x-rays that I had yesterday showed that the artificial disc, again, is in perfect place. He showed me a nice picture of it. Nice glowing artificial disc there between C5 and C6. And again, my scar is healing up nicely. It feels like I didn't get cut open, so gotta feel good about that. On the flip side, although I think the surgery was a success, and I think it's helped me in some ways, I have suspected that I have maybe a couple things going on, and it's going to get investigated. So I may have an ulnar nerve type thing as well, or something up here with some type of old injury, or maybe the shoulder, maybe something else going on with the neck, or some impingement that will also be taken a look at, and I'll have some nerve conduction studies done in a week or two, try to get to the bottom of that. So it's still kind of a long haul to kind of put this all together, but I feel good about the disc. And even if it only solves 10% of my problems at this point, the disc was going bad. It was going to have to change at some point. I'd rather get a nice artificial disc in there when I'm relatively younger. I'm in my late 40s, as opposed to it getting worse and having to deal with that later. So again, kind of a mixed bag. But as far as the recovery from the surgery itself, I feel like that's pretty much done. I was given the green light today to start to get a little bit more active, whether it's throwing the ball around with my daughter who plays softball, doing some very light weights, getting some more work on the exercise bike, things like that. I'm having a little trouble walking because I may have mentioned in a previous video that I do have some lower back issues. When I walk on flat surfaces for a long time, it irritates my lower back and makes my right leg kind of go into the sciatica mode and get a little bit numb. And when I was rehabbing from this disc surgery, I must have overdid it a little bit, even walking on the flat stuff. I normally hike up and down at elevation, and that doesn't hurt because I think the angles are always different, but just the repetitive flat surface gets me. So I've had to baby that a little bit, get my leg back in order, and I'll probably end up getting an injection for that later, which usually works well for me. It has in the past, and if I have to get surgery on that, I'll worry about that later. So, I just went from never having surgery in my life through my first almost 49 years to where now I may have, well, I've got one, and I may have a couple more on the way, but, you just got to do what you got to do. But I wouldn't give up the artificial disc procedure for anything. It's very doable. And I think for some people where it's really the only thing going on, I think it helps them immensely. So I'll provide further updates. But really, as far as the disc replacement procedure itself, I feel like, my recovery is going pretty smoothly. So until next time, thanks.